Hey guys, welcome back to our channel Medphonics Talks. I'm Mohammed Anis. I'm second year medical student from Fargana Medical Institute of Public Health. Today we're going to talk and start new topic. Till now we have studied general anatomy, some osteology and some joint and all. Today we're going to talk about upper limb, and in this playlist I have divided this upper limb topic into several subtopics. Like upper limb I have been divided into anatomical areas, then bones, about muscles, nerves, joint, blood vessels and lymphatics, and also about the hand and the nail unit also. So in anatomical areas, I have been talk about cubital fossa, then scapular region, these kind of areas, or a triangular area, quadrangular space, these kind of things we will talk about in anatomical areas. Then bones, we will talk about humerus, radius, ulna, then carpals, metacarpals, then phalanges and clavicle, and also the scapula. Then muscles, which is associated with the hand, forearm, and brachial region, everything. The nerves, joints which are associated, then blood vessels and lymphatic associated. In this topic, we will cover everything about the upper limb. So now here we are going to discuss about the bones which we are going to discuss in this topic, upper limb. So we already talk about upper limb bones, right? In the general anatomy, clavicle, scapula, humerus, then radius, ulna, carpals, metacarpals and phalanges. So here now we are going to talk. There are some divisions in our arm, okay, subdivisions in our arm, in our hand. Like till now we have told this whole structure is hand, right? No, we are going to divide into three subparts. First one, from the shoulder to the elbow joint, this is known as arm. Arm which is comprised of the humerus, then the scapula, clavicle, this joint, and the elbow joint. This is arm. And from after the humerus there is the elbow joint. After elbow joint there is radius, ulna. This radius, ulna, here and here, then the carpals. So from elbow joint to the carpals, this is forearm. This is arm, forearm. Then the hand comprises of metacarpals, phalanges. Metacarpals and phalanges are known as hand. So arm, forearm, hands, which is comprised of metacarpals and the phalanges. So clavicle and scapula together to form shoulder joint, and this shoulder joint is also known as pectoral girdle, which is formed with the help of humerus. Okay, so now we are going to talk about the weight transmission in upper limb. So this is actually, we are going to study how the weight is transmitted in our upper limb. So if I am going to pull or push something, or I am going to take something from the ground, so which all parts, which all sections in our hand, or which all bones will be affecting when I am going to pull this weight. So here you can see I have drawn something on the board. If I'm going to take a force from the down, so I'm going to take some force from the ground. This force will first transmit to the hand. Hand is which is having metacarpals and the phalanges. So I'm going to pull it out. Then from here it will goes to the wrist joint, right? The joint which is comprised of carpal bones. Then this joint, then it will transmit to the radius. Then it will transmit to the radius, and you know that in between radius and ulna there is a presence of interosseous membrane. So with the help of interosseous membrane, this weight from radius will transmit to the ulna. Here you can see radius to the ulna by the help of interosseous membrane. Then after ulna, you know that there is a joint, elbow joint. So from elbow joint it will transmit to the humerus. Humerus, which is the part of arm, and this is a forearm and this is a hand. Then between the humerus, scapula and clavicle there is a joint which is shoulder joint, also known as pectoral girdle, and this shoulder joint transmit the weight from humerus to the scapula and clavicle. And there is a ligament, coracoclavicular ligament, which is connecting the scapula and clavicle together, and from the clavicle and the scapula and the clavicle, this whole weight will transmit to the axial skeleton, which is the ribs, then the sternum, then the posterior bones, which are vertebral column. And from the clavicle and the scapula, this it will transmit to the axial skeleton by the help of sternoclavicular joint, which is present here anteriorly, sternoclavicular joint, and the costoclavicular joint, which is also present in the anterior. So this is a weight transmission. If you want to take a screenshot, you can take it now. So this was all about the introduction to upper limb. So I am planning to take the upper limb from the down to up. Like next video, the next upcoming videos will be phalanges, nail unit and all. Then we will go upwards, because it will be easy to you for understanding, because from humerus to the phalanges and nail unit it will be very complex for you, because you have just entered to anatomy now. So in next video we will talk about the nail unit. Till then, bye.